welcome to The Extra Mile. I'm Linda Boudreaux. Our guests today are William Buras, who is the Executive Director of the Southern Eye Bank, and Patrick Gandy, who's the CEO of Lafayette General Medical Center. We'll be talking today about eye donations or organ donations, primarily eyes, and the hospital and how they work together. So, gentlemen, welcome. Good to have both of you here today.
Thank you.
William, let me start with you because you're with the Southern Eye Bank, and that's really what we're talking about that today. So what is the Southern Eye Bank, and what's really going on with all that?
Southern Eye Bank is a nonprofit organization that recovers and distributes ocular tissue based on need.
And need would be what?
Persons who are in need of corneal transplants,
Okay.
Also research, but mainly what we're there for is to help people see again,
Okay.
to help regain their sight. Those who've had corneal injuries through abrasions or chemical injuries, etc. There's many genetic ones that we want to be there to help those people to be able to see again. And so that's what we're there for, the community and for everyone.
So would the eye bank just does corneal transplants?
No, we do corneal transplants. We also do scleral transplants for glaucoma shunts, but that's mainly what the eye bank does is for eye donation.
Okay, so whatever however we can use eye tissue to help someone else to regain or save their sight. That's really kind of
that's what we do as far as through the eye bank. Yes, ma'am.
Okay, and Patrick, Lafayette General, what do you all have to do with eye banks over there?
Well, Lafayette General Medical Center, we're a 377-bed nonprofit and growing, absolutely. But we're a nonprofit 501c3 hospital. We're here for the community and owned by the community. We're the largest hospital in South Central and Southwest Louisiana, and so as the largest facility in that area, we feel that it's vitally important for us to support Southern Eye Bank and LOPA because with our support we're able to reach out and provide a positive benefit to those recipients of organs and tissue.
And I guess the other piece of it, and we were talking about this before we started today, ultimately I guess we're looking at recipients, but donors' families also can benefit from this process once they make the decision. Is that fair to say?
Yes, ma'am. Definitely from our side, we deal a lot with the donor families. I know the hospitals,
You're the front line.
They are
Absolutely.
the first line of how it works, but we deal with the very intimate part of when we're trying to get the donor families to actually talk about donation and to make that decision. It's a very personal decision, but it does help a lot of families when they decide to donate, and a lot of that happens with the help of Lafayette General and some of the other hospitals in the area. Without those hospitals, those families may not have that closure about helping others. And Lafayette is a very giving parish.
We are.
It's a very giving people all around here, and without giving them that option, you're taking that from people. So we want to make sure we're able to give them the option to help not just themselves when they're going through a tragic time, but also through the other families and the other members of the community through eye donation.
Okay.
So, and that's what we use with Lafayette General.
Yeah, what we've seen is that donation, organ tissue, corneal donations help, in many circumstances, families cope with the loss of a loved one, and it helps them cope with that loss because of the benefit and truly the gift of the donation to the recipient and the positive impact that it has on the recipient's life.
So let's talk about organ donation in general and eye donation in particular, because you can't really talk about one without talking about the other, because
Absolutely.
It's really the same thing. It's just that you're specific
Exactly.
and that it's about eyes. But organ donation is something that I don't know if people are still squeamish about it, because we talk about it a lot, but I don't think we can talk about it too much, because at the time that a decision has to be made, you're in a crisis. And so it is better for everyone, would you agree, to talk about it ahead of time with your family members and make decisions ahead of time?
Absolutely. That's one of the main points of education that we do out in the community, is to make sure that family members are able to talk to one another. It's an open communication for what we need to do. Without that education, without that openness to discuss, it does make it harder in that crisis. You may not be thinking completely straight in that moment.
Let's assume you're not.
Away.
Let's just
if you assume you're
not,
you may not know what your loved one wants to do. And a lot of times with donation through the donor registry, working with LOPA, those people have already made the decision for you. But if you haven't discussed it with your family member, then they don't know what your decision is, and so you're basically making that decision for them. Mm-hmm. And a lot of times you get very protective when something happens to a loved one, and you may not want anything to happen to somebody. You don't want anything else to happen to them. but you don't realize the benefits that that person made on their own to actually donate and to actually help other people in the community. And that's part of what our education is for both LOPA and for the eye banks as well. So.
Okay.
Yeah, we feel very strongly that communication on the front end is incredibly important, because at the time the decision is made, it is very difficult, it's very personal, and understanding the benefits of organ donation prior to being put in that situation is paramount. It's very important.
So, what are the benefits of organ donation?
The benefit is the gift that is provided to individuals, patients that are in need of those organs, the tissue, cornea. There's a real opportunity through organ donation to be able to help others. And in our community and elsewhere throughout the country, most people, when you have an opportunity to help others, you want to take that. And so that opportunity to help others and that gift to the recipient is the driving force behind it.
Right. And one of the main things also is you're actually not just giving of yourself, what the person is at that moment, but you're actually helping bring those people who are not able to maybe effectively communicate in the community at this time, giving them a second chance on life, to get them to actually be able to to give back to the community on their own end. Corneal recipients who may not have been able to drive or maybe not been able to read because of damages to their eyes now can get jobs, now can actually go work into the force, and actually it doesn't just bring money back into the community for them, but it actually helps the entire parish. It actually helps those individuals who may be on the tail end of their life because that's what they assume, but now they have a whole new outlook on life, and they can sit there and last for, go another 20, 30 years and enjoying life and contributing back to the community and to everyone else. So.
And so it really is, you just can't really put a price, you can't find words. I'm looking for a word and I can't find a word. There really aren't enough words, I guess, to describe how powerful and important it is to give someone their life back.
It makes a difference. It makes a difference in people's lives, and that's the bottom line.
And the only way that we can make that difference is through an organ donation.
That's correct.
Because there's no substitute for that.
Through organ, tissue, and eye donation, that is the only way you can make that type of difference. You can give someone back their life. You can give someone a better life through all of that, and it takes those people actually making that gift. It's not just a gift of sight that we deal with the eye bank, but it's a gift that you're giving of life when it has to do with organ. It's also a gift of a better life for those who go through tissue donation at that point as well.
And I've heard people whose family members were donors who had made the decision for a family member to donate, that a part of that loved one lives on. I mean, there is that also that happens, huh?
It's very real, very real. At Lafayette General and in all of our facilities, we talk quite a bit with our employees about purpose, worthwhile work, and making a difference in people's lives. And the families of donors, that's what they're doing. Those decisions and making the decision to donate, that has tremendous purpose, it's worthwhile, and it makes a difference in people's lives. And so that's something that we feel very strongly about within our health system.
Absolutely.
So let me ask you, how do you make it happen? Like if someone goes into your hospital and they die, and they're going to be a donor, or they're not, how do you talk to the family? How do you make this happen?
On the front end at the facility, we have a interdisciplinary team comprised of our physicians on our staff, our nurses, our case managers, our social workers, all coming together and working with the family.
Okay.
And we also, when someone passes away at one of our facilities at Lafayette General Medical Center, we call LOPA.
And LOPA is?
Louisiana Organ Procurement Agency. And we reach out to LOPA, and then LOPA will contact Southern Eye Bank as they do an assessment, a screening of that patient. And from there, Southern Eye Bank then will contact us as necessary. And we facilitate as much as we can with either LOPA or Southern Eye Bank, facilitate discussions with the family also making sure that they receive the clinical information that they need to appropriately screen the patient.
Because that's key, isn't it? I mean, you can't, not everything is usable, and so you have to be able to have that clinical piece.
Absolutely, and that is one of the most important things that we have to do on the front end, is making sure that Southern Eye Bank has the information that they need to be able to make the best decision possible.
Right, and that's one thing that Lafayette General does do very well in our community. We have staff who sit there and they'll take those phone calls that Wayne had talked about, and we screen those donors. We take that information that they had actually called into LOPA and make that determination of donor suitability.
So what are you looking for in a donor?
A lot of times with donors, especially with eyes, eyes are probably the most easier gift to give than anything else. You have a cancer patient who may not be able to give for certain items, but they can give for eyes. So you're looking just for the medical history, what kind of history that may screen, rule them out for actual donation, but eyes allow so many more donations than anything else to actually occur. You could have had a previous blood infection that if it's cleared up, you're fine for donation. You could have had cancer, again mentioned, that you can now still donate your eyes for transplant. And so it's usually where eyes, it's one of the few items that you're able to donate throughout the course of a person's life with all the medical histories that may happen. And a lot of people will go into the hospitals with an extensive medical history. But it's good that there is still something that they can actually donate and help out to the people. And we train our staff very, very well to sit there and talk and learn how to interact with the hospitals. And we talk to so many different departments in Lafayette General as well. And so his interdisciplinary approach is actually very important for us as well, because we reach each of those different disciplines and discuss different items about that donation before we even make an approach on the family at that point, because we have to make sure we don't want to put a family through any excess grief when we may not be able to use them as a donor. So we want to make sure that we talk to them and discuss everything, and that's one thing that Lafayette General does extremely well.
So if you can't use somebody as a donor, I mean, what would preclude somebody from being a cornea donor?
Usually for a corneal donor, it'll be maybe some of the major illnesses, HIV, hepatitis, because those are certain diseases that can actually be transplanted through corneal donation.
Okay.
But most other illnesses, even if you cannot donate for transplant, we do a lot of research at Southern Eye Bank. We work with a lot of the hospitals, a lot of the researchers across the country who are actually looking for different eye diseases that they can actually sit there and do some study on to maybe help cure some of these diseases, in the long run.
You never know what parts of you can be used.
Absolutely not. So.
It's just amazing.
Right. So you may not be able to be suitable for transplant at that moment, but you may actually help, facilitate someone not having to have any kind of issues later on
It's
in life.
just
So.
a really big deal. I had
Yes, ma'am.
an aside, but I had a friend who she died of a heart attack, and she was in her 60s when she died, and she wanted to be an organ donor. We talk about how people don't want to do it, but she really did. And then it turned out all she could donate was her corneas.
Right.
And at first everybody was disappointed. It was like, oh, she wanted to do so much more, but really she did so much.
Right, and we never want to sit there and make anyone think that any part of that gift is not as great as any other.
Yeah.
Yes, you may be able to donate your heart to someone, but donating sight, as much as people may not think, is such an important gift because it extends beyond anything else. You may be able to live in, but if you can't see, sometimes that makes a big difference. And it's an amazing gift, and we get so involved with it, and we get so passionate behind it that I've been here for 13 years, and I hope to be on here for a lot more.
And it's a gift that isn't always that hard to give. Compared to some of the other stuff that we try to give.
Right.
Sight's kind of doable.
Absolutely.
The gift of sight is huge, and over the past year at Lafayette General, we've had 49 donors. But that provided 70 individuals with the gift of sight.
Wow.
And so that's huge. And over the past 5 years, we were just talking over 250 donors over the past 5 years at Lafayette General, providing over 350 individuals with the gift of sight. That has made a difference in a significant number of people's lives within our community.
And you can't even imagine the ripple effect of how it affects their lives and the lives of others, and as we go further and further out.
And that's one thing to actually look at, is even though you may be giving some one person the gift of sight, you're actually helping an entire family, an entire community, because if that person is having trouble seeing and they cannot go to certain places without the help of everyone else, you're now allowing that person to be able to be independent And that makes such a difference in someone's life, is not having to rely on everyone else to be able to live.
Yeah.
And so it does. It has that ripple effect that just keeps on going from that
These are
point on.
really big deals. I want to talk just for a few minutes about your two agencies or organizations. Southern Eye Bank serves where?
Southern Eye Bank serves pretty much the entire southern part of Louisiana. We go from Ville Platte all the way down to the Gulf of Mexico. We cover from the end of the state line by Lafayette, Lake Charles all the way over to the Mississippi line, with the exception of Baton Rouge. Baton Rouge has their own eye bank there that's really a very good eye bank. But we are the largest eye bank in the state. We cover the second largest area, but we have the highest populations in our area.
Really? Oh, that's right, because we have New Orleans and all
New
that.
Orleans and Lafayette and Lake Charles,
Okay.
and from there, yes, ma'am.
Okay. And when were you founded?
We started in 1947. We were the third oldest eye bank in the country.
I didn't know eye banks had been around that long. I thought they were
Yes,
kind of
ma'am.
a new, I thought this whole transplant thing was kind of new.
Well, actually, corneal donation is the oldest transplant that's out there. The first transplant was in 1905.
Wow.
And so it's quite old at the transplants. The Southern Eye Bank is going to be 67 this year. The
birthday
first
to you.
Eye Bank was only 2 years before us in
So we're like the
1945.
second eye bank?
We're the third oldest eye bank in the country. Yes, ma'am.
So what was going on to make us so progressive and ahead of the game?
We had a very prominent medical society, ophthalmology society in New Orleans initially who started. They started working with some of the doctors in Lafayette and Lake Charles, trying to actually put a center in New Orleans, because the closest one was up in the Northeast in New York and in Boston.
Okay,
And so all those people who were coming back from the war with eye injuries and everything from the South were getting kind of left behind. And so New Orleans and all these areas have been very populated and have always wanted to help those people. So they got together after about 2 or 3 years, they would put the eye bank together, and we've been going strong ever since. So first transplant was in 1948.
Wow, see what visionaries
Wow.
can do for you?
Absolutely.
Absolutely.
So are those transplants pretty simple to do?
The corneal transplant it's actually a lot simpler than a lot of the actual eye surgeries. It is
I know
time
it-
consuming,
okay.
but I mean, we actually handle the front part of it. We work with a lot of the medical directors, both here in Lafayette as well as in New Orleans. And we do a lot. I mean, there are actually 45,000 corneal transplants a year across the United States.
Wow.
90+ thousand across the world.
Wow.
Last year, just for Southern Eye Bank, we helped facilitate over 1,000 transplants. So it's a very easy procedure. It's actually the least type of procedure or transplant that will have any type of rejection. So it's a very positive thing for everyone.
So just across the board, they're easy to harvest, I guess, and they're easy to transplant, and so and the benefit is great, and so
Absolutely.
there's really no reason why we shouldn't all be corneal donors. I'm thinking.
Absolutely.
Organ and tissue
Organ and
donors.
tissue as well. So yes,
Yeah,
ma'am.
organ and tissue donors.
So what about Lafayette General? You know you're on the move. We know that here at Lafayette. We know that
We
for
are
sure.
we're definitely going through tremendous growth right now, which is wonderful for our community. Lafayette General, we've been here since 1911. We just celebrated 100 years 3 years ago. So,
Happy birthday,
yes,
belated.
yes. But we've been here serving the community now for over 100 years. Lafayette General Medical Center is the flagship facility of Lafayette General Health. We own and operate 4 other hospitals throughout Acadiana, in addition to Lafayette General Medical Center. And as I had mentioned before, we're the largest facility in South Central and Southwest Louisiana.
So what are your other 4?
We have Lafayette General Surgical Hospital, which is on our campus, St. Martin Hospital in Breaux Bridge, Abram Kaplan Hospital, who we manage, and then we recently took over what was formerly University Medical Center, now University Hospital and Clinics, and we took over management and operation of that facility this past summer.
So that was a big undertaking, and let me thank you for doing that, because I was
Well.
a little concerned, as
Well,
many of us were, I'm sure. Because,
It was a very big undertaking, but when we were looking at the situation in our community, we felt we needed to step up. That was part again of our mission. While we're here, we wanted to step up, save the facility, save graduate medical education.
Absolutely.
We're training the doctors of tomorrow in Lafayette right here today, And that is something that makes Lafayette unique in our state, is that we do have training programs here, and we felt very strongly that we need to keep those training programs here and keep University Hospital open for all of Acadiana.
I second that. That was one of my big concerns. It's like, what are we going to do without training the doctors? I mean, it's like
well, that's a positive for Southern Eye Bank, the fact that they actually get into the community and actually help and train the doctors, because we have our own surgeons who go through Lafayette General from out in this area.
Oh, really?
And actually do some of the training out here. We have some of our
That
medical directors.
partnership again.
That partnership, it's not just on the level of talking about donation, but it's on all levels, and we help educate at the hospital as well. If anyone needs to know anything about corneal or organ or tissue donation, we work with LOPA and with Lafayette General to make sure that everyone's educated across the board.
So really what you're doing is integrating systems.
Absolutely.
As much as
Yes, integrating and having those types of partnerships will be very important to everyone's success as we move forward in a somewhat uncertain future, but we know having the right partnerships in place will serve us well as we move into the future.
And as we move forward, and especially with changes in healthcare and how we pay for it, are these procedures still going to be covered through affordable healthcare and those kinds of things?
As of the moment, at least for corneal donation, it's handled mostly through Medicare.
Okay.
So that's a item that we work with the hospitals as well to make sure all that happens. Being that we're nonprofits, we work through processing everything try and keep our fees as low as possible. But really, it's a Medicare system that we work with, and we do that with the hospitals as well. So
Right.
we don't know what will happen in the next few years, but we always hope that it'll be able to keep everything low and still work and get all the transplants occurring at a good rate, as well as the extra donation for the hospitals as well. So.
Yep.
And you were saying earlier how many corneal donors we had from our area and how many people were helped. The corneas can go anywhere, though. They didn't all stay in Acadiana, I'm thinking, huh?
Yeah,
We share, don't we?
Yeah.
Right. Well, and that's one of the major things as far as with the people, even of Louisiana and especially Lafayette Parish, is that you may have 350 plus transplants in 5 years, and you may have 100 of them being, or 200 of them being in this region, in the Lafayette,
Right.
Lake Charles region. But you're also having those that go into New Orleans, into other parts of the country, and they go international as well, all the way to Brazil, Argentina, Ecuador. Some have gone to South Korea. So it's not just helping those people in Lafayette. You're helping worldwide from a simple
Wow.
donation. So.
Wow, that's pretty powerful,
Yes,
huh?
ma'am.
Absolutely.
And how do you decide who gets them?
Who gets the actual donation?
Yeah.
Well, at that point, it's a ethical system. We base it first on emergencies. Any kind of emergency surgeries come first. Then you're looking into the local region. So if it's not an emergency, it goes to our areas first. So you have Lafayette, New Orleans, everything from there, and then it gradually expands from regional to national to international at that point. So and it's based on need. If someone is in need of a transplant, we're hoping that we have the corneas to be able to help them with.
Okay, and do we need more?
Always,
No.
yes, ma'am.
Okay.
Yes, ma'am. We may do 45,000 in the United States, 90,000 across the world, but there's no replacement for corneal tissue at this moment. So
Okay,
we are
so-
always in need of corneal tissue.
So we don't have any kind of synthetic cornea at this point?
Nothing that will
we-
actually replace the physical aspect of the cornea. There may be patches that can be synthetics, but not to do what the actual cornea does. There is nothing that that can replace a human cornea.
Aren't we amazing?
Absolutely.
Think about it. Think about it. In the last minute, let me start with you. Anything you want to say for closing?
No, I'd just like to say we're very happy and very proud of Lafayette General. For the past 5 years, they've had the most donors, and our partnership has been such a positive for the people of Louisiana as well as for the people of Lafayette Parish, and we hope to have many years in the future. So,
Patrick, anything you want to add?
Just that Lafayette General is committed to our partnership with Southern Eye Bank and LOPA. We feel that it's a vital program and a vital partnership, and it's important because of the gift and the benefit to the recipients, many of which are in our community and in our state. So as our community hospital, we're committed to that, and we look forward to our relationship with Southern Eye Bank and LOPA moving forward.
Okay, well, thank you both for being here
thank you very
today.
much.
Good.
And thank you for watching The Extra Mile, and do consider being an organ donor if you haven't made that decision already. I'm Linda Boudreaux.